about how to prepare students for the pelvic floor, teaching their students. A lot of people don't even know about the pelvic floor. So let's talk about it. So yeah.
First of all, what are the muscles?
Yeah.
Where are the muscles? Yeah. So it's a muscular layer at the bottom of our abdomen, at the bottom of our trunk. We can all feel our pubic bone at the front here, a bony prominence there, and so the muscles attached just on the back side of that bone. We can't feel it with our fingers, but just on the other side of where our fingers are is where the bone is. We can then also feel our tailbone at the back, so you can feel if you come down the bottom of your spine to just between the top of your buttocks, the coccyx there, so the muscles attached to the coccyx at the back there. And then if you put your hands just underneath each of your buttocks, you can feel your sitting bone there. If you stick your bottom out a little bit,
oh yes,
you can feel your sitting bones there.
Yes.
And if you're sitting on a chair, you can rock from side to side and feel them. And so the muscles attach all the way to the sides there. So
how do we squeeze them?
All right. One of the easiest ways to test it out is to, as an occasional thing, stop the flow of wee when you're on the toilet. So when we sit down on the toilet to do a wee, or in the case of the men, they're still standing up, but we all need to relax our pelvic floor to allow that wee to happen. If you can stop the flow midway by trying to squeeze the muscles back up again, those are the right muscles.
Right.
So the good thing is if you were to try that and just hold your breath, you're not going to stop the flow because it's not the right muscles. If you were to do that and just squeeze your buttocks, you're not going to stop the flow because it's not the right muscles. Once you can stop the flow though, you know it's the right muscles, you don't need to do it again.
Oh,
so
okay.
you know do not keep doing it. The normal pattern to do a wee is to sit relax and empty. We don't want to mess with that. Properly.
So this type of exercise is actually just to be done like this.
Yeah, this is the best way to do it.
Right.
We want to do it in standing because if we're going to have problems with our pelvic floor muscles, and when we've got problems, what we notice usually is a bit of weakness or poor timing, and that will result in losing a little bit of weight. When we cough or sneeze or laugh,
exercises.
Yeah, that's
so
right. Very
let's do
common
the test.
All right. So first of all, in standing, because this is where it's important, anti-gravity, we want to make sure that we're breathing properly. So we want to make sure that we're breathing through this upper part of the abdomen and the lower part of the chest. So the upper chest is really relaxed, and we can get a sense as we breathe that we're expanding down here, that this upper part of the abdomen is quiet. I want you also to make sure that the lower part of the abdomen is quiet to begin with, that you're not tending to hold it in, puff your chest up, that it is all quiet and relaxed. Now think of the pelvic floor muscles, get a good picture in your mind of where those muscles are attaching to the coccyx at the back, the sitting bones at the sides, and the pubic bone at the front there. I like to visualise a zipper closing up from the back passage, the vagina, the front passage, and then coming around to the pubic bone at the front here. That helps them with that visualisation, but really getting that sequence in and feeling it at the back, in the middle, at the front, a sense of coming together as well as drawing up through there, but keep breathing. Sometimes I say to people to put one hand on the pubic bone and the other hand just on the side of your buttocks, like that, just so that you can make sure that your buttocks stay quiet. That you lift with the pelvic floor.
Quiet, I like that.
You like that?
Quiet.
Yeah, the buttocks stay quiet. Don't squeeze them. Don't have them involved. They've done studies, and after reading a brochure or having information presented, a third of people still can't do it right.
Okay,
that's
good to know.
It is tricky.
Yes, okay.
It is tricky
to do. Is the only test, is there any other test? I mean, you can
That's the test, yeah.
Right.
Our abdominal muscles we're much more aware of, and it feels much more definite to do something quite strong through there, or to squeeze your buttocks. They're much more definite. It's really subtle. There's nothing to see. We would have noticed on the video that there is nothing to see when we're doing a lovely squeeze. We're still breathing. Our shoulders don't move. Our buttocks don't move. There's a teeny change at the abdominal wall down low, that there's a little bit of tensioning down here, but nothing up here. It's so quiet.
So you said that it's mostly women. So men who are going through prostate cancer is probably a big group that should be really doing so.
And unfortunately, the labelling so far in physiotherapists, when we work in continence, we're referred to as women's health physios. Yes. We actually do men's health as well. So it's a terrible labelling issue. but the men are not to be feeling excluded.
Okay.
Many of us that work in women's health also work with men's continence issues. Yeah. When men have a radical prostatectomy for cancer, their internal sphincter for their bladder is removed. Yeah. Yes. So they do need to learn new continence strategies. Ideally, to see physio before they have their surgery so that they can learn to do it before there's pain and before they're incontinent.
Okay. That's what I wanted to say, the benefits, and it's about, be open to it and, and it's okay.
One of my patients had a prostatectomy late last year, and by the 3-month mark he's starting to run.
Wow,
which is utterly important in his life and for his well-being.
And how often
we've talked all the way through.
How often would you say to be doing these exercises?
Oh, these exercises have to be every day.
Yep.
It's like cleaning your teeth.
Right.
It's just one of the things you do to look after yourself, to keep things healthy.
Right.
When we're doing the squeeze, we want to hold it for 10 seconds. And ideally, we'd like to do 10 repetitions.
Okay,
it's a muscle. It's skeletal muscle, just like any of these other muscles.
So you really can do it anywhere.
You can do it anywhere.
While you're doing the dishes.
Yes.
You normally need to concentrate early on.
Okay.
So I would suggest it's something that you do just before you clean your teeth.
Okay.
Nighttime's normally best because it's less hurried.
Yeah,
mornings for a lot of people are a bit busy, a bit frantic.
That's a great tip.
And so one of the things that I recommend to people is that they put a coloured rubber band on their toothbrush, and when they pick up their toothbrush at the end of the day to brush their teeth, that's me saying to them, have you done your exercises yet?
Wonderful.
If they haven't done their exercises, they have to put it straight down, do the exercises, and then brush their teeth. Yep. And the reason they have to do it that way is because if they brush their teeth first, they'll go straight to their normal routine, which is brush your teeth, spit, wash your face. Go. And you'll happily go, and you'll go to bed without having done your exercises, but you won't go to bed without cleaning your teeth because you do that every night.
Well, Tori, we like that because the whole thing with a lot of what our program's about is about the how, and often it's we want to do these things, we've heard about
how do we do it,
and it's more about how can I make this part of my routine.
Right.
So that's a fantastic tip.
Yeah, you always have to attach it to something you already do without fighting about it. A non-negotiable. And so the more you can attach it to one of your non-negotiables, the better.
Right. So really, with lots of things that we are talking about in our program, that tip is
it's fabulous.
You can use that with a few things.
We can use
you can borrow that.
Absolutely. The Tory tip.
The Tory strategy.
There you go. Immortality.
Thank you so much for that.
My pleasure.
So we did